The name of this company is Philadelphia American Life Insurance Company, or PALIC for short. The company was founded in 1924, with the current management taking over in 1989. PALIC is part of New Era's family of companies and is headquartered in Houston, Texas, with a BBB Triple Plus rating by AM Best. Current major medical plans have been a staple for most Americans. However, their costs have increased greatly since the emergence of the ACA. The major reason for the cost increase is the 10 essential health benefits, or EHBs, that must be embedded in all major medical plans. 8 of these benefits are included in some way in the PALIC plan. They are hospitalization, prescription drugs, emergency services, laboratory services, ambulatory patient services, rehab and facilitative services and devices, preventative, wellness and chronic disease management, and mental health, substance abuse, and behavioral health. The PALIC plan has some form of these ACA benefits. However, the PALIC plan does not have maternity and newborn care or pediatric dental and vision care. While these 2 benefits are great for young consumers, it's not a necessity for all persons and contributes greatly to the cost of a policy. Therefore, we would advise that if maternity is something that may be needed in the near future, you may be better suited purchasing an ACA plan. The PALIC plan can include dental insurance with the vision discount program in a separate policy and may already be included in your quotation. Also, all ACA plans must have no pre-existing conditions limitations, unlimited coverage, no copays for routine physicals. Each one of these benefits is great for the consumer. However, it does increase the cost of a policy. As an example, with a no pre-existing conditions limitations clause embedded in every ACA policy, a person can sign up for an ACA plan in the hospital in the middle of December. If the patient stays in the hospital through January, in this example, the major medical policy will be billed for hospital charges starting on January 1st, sometimes before reviewing their first payment from the policyholder. You can imagine the additional costs this could add to an ACA policy. The HSPGold policy keeps costs under control. The HSPGold is a high-end defined indemnity benefit plan and not a major medical insurance plan. Defined indemnity benefits are provided for hospital confinement, specified medical, surgical, and outpatient events. These benefits are paid in specific amounts and do not provide expense reimbursement for charges based on your healthcare provider's bill. Now, here is a medical plan comparison. With a major medical plan such as Blue Cross and Blue Shield or Humana, their plan pays based on the expense incurred. The deductible is applied against eligible expenses before the insurance starts to pay. With PALIC's high-end hospital indemnity plan, the plan pays based on the defined benefit schedule, very similar to Medicare. The deductible is applied against the eligible benefits. Here's an example of how deductibles are applied under a hospital indemnity plan. The deductible is applied against eligible benefits and not eligible expenses. It's simple. Add up the reimbursement for all eligible benefits and subtract the selected deductible. This is how it works. In this example, we have chosen a $2,500 deductible and use eligible benefits based on 3 units, also known as the preferred plan. The definition of a unit is a category of benefits with a specific dollar value. There's a total of 3 groups or columns of benefits associated with specific dollar values. Group or column 3, also known as preferred plan, is the richest with the highest dollar value. Once you have signed on to a column, you will keep the dollar value associated with that plan of benefits. Here is a 3-day hospital stay for an injury which pays $6,750 a day. $6,750 times 3 days equals a $20,250 benefit to the facility. The surgeon is paid $4,954.65. The assistant surgeon receives 20% of the surgeon's fee, or $990.93, and the anesthesiologist receives 25% of the surgeon's fee, or $1,238.66. Therefore, the total eligible benefit in this example adds up to $27,434.24. Next, we add the total benefits, then subtract the deductible. Unlike a major medical plan, but more common in auto insurance, we subtract the $2,500 deductible last. Now, we are left with the total benefit paid to the hospital, which is $24,934.24. This is what PALIC pays out, not what the hospital charged. PALIC will always pay the total benefit amount. Therefore, if the hospital charges $20,000, PALIC will pay the hospital's charge of $20,000, and the policyholder will receive a check for the difference, $4,934.24. On the other hand, if the hospital charges $26,000, which is $1,065.76 more than PALIC will pay, the policyholder would owe the hospital the difference. Moving forward, the main purpose of this presentation is to educate policyholders on how to keep medical costs below what the hospital charges by using the multi-plan PHCS PPO network. Now, let's see what's in the policy. The key features of the HSPGold policy includes the following: a $5 million lifetime maximum limit per policy. You may choose from 3 benefit options. You pick your base plan deductible. You pick your calendar year benefit maximum level. You get to choose the number of benefit units to fit your needs. In addition, you can use any doctor or hospital you choose or select from the large PHCS PPO network of doctors and hospitals to take advantage of greater savings. Many doctors participate in this nationwide PPO network. You have the option of 7 calendar year deductibles. You may pick one of the following deductibles: $100, $500, $1,000, $2,500, $5,000, $7,500, or a $10,000 deductible. In addition, this plan has a hospital admission benefit for the first inpatient day. This is one benefit per insured person per calendar year. The first day admission benefit ranges from $1,000 to $3,000 depending on the deductible chosen. The higher the deductible, the larger the benefit. The HSPGold plan lets you choose a calendar year maximum benefit per calendar year per covered person on the policy. The most commonly chosen benefit is the $250,000 calendar year option. However, if you require more calendar year benefits, you may choose the $500,000 or $1 million annual benefit options. So think of the annual maximum benefit as being a bucket of money you purchased. Each time you have an eligible medical expense, money comes out of the bucket to help pay those expenses based on the benefit plan selected. Every year, Philadelphia American refills the bucket. This only means that at the beginning of the year, January 1st, PALIC maintains a minimum balance of your chosen calendar year benefit. In this example, it would be an annual benefit of $250,000. When you receive services at the hospital, you have an itemized bill. This bill will include a facility fee, which is the hospital's costs, and a service fee, which includes the costs for professional medical personnel such as the surgeon, assistant surgeon, and anesthesiologist. This page addresses only the facility fees of the HSPGold policy. Remember, the definition of a unit is a column of benefits. Once you have selected the number of units that fit your needs, you will remain in that column. We will focus on 3 units or the preferred plan for this example. First, it is important to have a frame of reference on the national daily average costs to stay in a hospital. This would be the facility fee. According to the Kaiser Family Foundation, a nonprofit leader in health fund analysis, Kaiser estimates the national daily average costs to stay in a hospital is $2,517. This does not include the discounted repricing from being in the PHCS PPO network. For a hospital confinement, meaning you are admitted and stay overnight in a hospital, on the preferred plan, the benefit is $4,500 a day for a sickness and $6,750 a day for an injury. On the preferred plan, with the hospital intensive care unit confinement, the plan will pay the daily benefit selected of $6,750 a day for a sickness and $7,500 a day for an injury for a 20-day period. On the 21st day, this benefit converts back to the hospital confinement benefit of $4,500 a day for a sickness and $6,750 a day for an injury. For confinement in a hospital for mental illness, alcohol and/or substance abuse, the indemnity benefits are stacked. The preferred plan benefit is $600 a day, plus the hospital confinement benefit of $4,500 a day, bringing a total daily benefit of $5,100 a day. When using the rehabilitation and skilled nursing facility indemnity benefit on the preferred plan, the indemnity benefits are also stacked. With 3 units, the plan will pay a daily benefit amount of $2,250 a day, plus the hospital confinement benefit of $4,500 a day. This brings the total benefit to $6,750 a day. For outpatient care at a hospital or an ambulatory surgical center, the plan will pay the daily indemnity benefit selected for outpatient hospital or ambulatory surgical center services when surgery is performed as a result of a covered injury or sickness. In addition, the calendar year policy deductible is waived for each covered person when surgery is performed on an outpatient basis. On the preferred plan, when surgery is performed under general anesthesia, the benefit is $5,000 a day. When surgery is performed but not requiring general anesthesia, the benefit is $2,250 a day. General anesthesia only means you are put to sleep during the procedure. Finally, when a covered person receives treatment for outpatient radiation or chemotherapy when confronted with cancer, the preferred plan benefit is $2,250 a day. As mentioned before, professional services such as the surgeon, assistant surgeon, and anesthesiologist fees are itemized and billed separately. This page addresses the professional medical services performed in a hospital. This benefit, inpatient physician's care indemnity benefit, non-surgical, is paid for each visit a covered person receives from a physician while confined. This is usually used when a doctor visits a patient after an operation for an update. The preferred plan benefit is $150 a day. For surgical benefits, the plan will pay the daily surgical indemnity benefit if a covered person undergoes a surgical procedure when performed in a hospital or an ambulatory surgical center due to an eligible injury or sickness. When the surgical procedure is performed in an outpatient hospital or ambulatory surgical center, the deductible will be waived for the first claim incurred in a calendar year for each covered person when surgery is performed under general anesthesia. The reimbursement schedule for 1 unit for surgical benefits is equal to what is payable under the Medicare Physician Fee Schedule for surgeries. This is also known as the Resource-Based Relative Value Scale, RBRVS, which is used to determine how much money medical providers should be paid. The preferred plan benefit is 3 times the RBRVS to a surgeon. For inpatient pathologist and/or radiologist on the preferred plan, the benefit is 3 times the Medicare Physician's Fee Schedule. The Daily Assistant Surgeon Surgical Services Indemnity Benefit for covered services pays 20% of the eligible surgical benefit, while the Daily Anesthesia Indemnity Benefit for covered persons pays 25% of the eligible surgical benefit. These are common percentages used by professional services. This page is dedicated to outpatient benefits, such as doctor's office visits, lab work, x-rays, prescription drugs, and urgent care. Keep in mind, the indemnity benefits shown on this page are what the insurance company pays. These are not copays. For doctor's office visits, the plan has 20 visits per year and has a benefit of $160 a day for the preferred plan. The 20 doctor's office visits can include 2 specialist visits and 6 chiropractor visits. For a specialist, on the preferred plan, the benefit amount is $200 a day, and if surgery is performed in office, this benefit amount is increased to $300 a day. Here's an example of how this indemnity is applied. Let's say the price to see a doctor in your area is $120 a day. When you stay in the multi-plan PHCS PPO network, you will receive their pre-negotiated price. This means you receive a substantial discount. In many instances, the discounted rate is between 20% and 40%. When you present your card to the doctor's office, if given a discount of 20%, this will reduce your cost from $120 a day to $96 a day. Remember, to see your primary care physician, the plan pays $160 a day. As a result, if you have chosen the preferred plan, you will owe nothing at the doctor's office. You will receive an excess indemnity in the mail for the difference between what the plan pays and what the doctor charges, or $64. If, on the other hand, the pre-negotiated price is more than $160 a day, you pay the difference at the time of service. Remember, this plan always pays the benefit amount to someone, even if there is another insurance policy acting as the primary for the insured. For the following outpatient benefits, the price range can be huge. By staying in the PHCS network, in many cases, the price charged can be less than the benefit. Therefore, staying in-network is a huge plus for the consumer. For other outpatient benefits, the HSPGold plan will pay the following when purchasing the preferred indemnity benefit. For MRI, CAT scans, or nuclear testing, the plan pays $700 a day. For other diagnostic testing or X-rays, the plan pays $240 a day. These two benefits are enhanced tremendously for accidents when paired with the Enhanced Accident Expense Plan, which is included in most quotes. We will review this later in the presentation. For laboratory testing, the plan pays $120 a day, and for injections, the plan pays $90 a day. The emergency room benefit and urgent care benefit collectively have 2 daily uses per calendar year. The emergency room benefit has a limit of 2 uses per calendar year and pays $800 on the preferred plan. The urgent care center benefit has a limit of 2 uses per calendar year and pays $400 on the preferred plan. Remember, these benefits collectively have 2 daily uses per calendar year. The emergency ambulance indemnity benefit is limited to 3 benefit payments. 2 benefit payments per day for ground transportation, which is $1,000, and 1 benefit payment per day for air transportation, which is $2,500. These benefits are increased substantially for accidents, which will be presented later in this presentation via the Enhanced Accident Expense Plan, most likely already priced into your premium. The daily generic prescription indemnity benefit is $30 a day on the preferred plan. The brand name prescription indemnity benefit is $60 per day with the preferred plan. The prescription drug benefit is the only benefit that is reimbursed by simply sending your receipt to PALIC. It may be more convenient to send receipts every 6 to 12 months as opposed to each time a prescription is bought. Next up is the preventative care indemnity benefit, which starts 60 days after the effective date and is limited to 1 benefit per covered person per calendar year. This benefit is not subject to the pre-existing conditions exclusions clause. The preventative care benefit includes things like mammograms, pap smears, colonoscopies, etc. This benefit pays $250 for a mammogram, $500 for a colonoscopy, and $250 for all other preventative services per calendar year. When you qualify for an HSPGold policy, the plan covers pre-existing conditions after 12 months of continuous coverage on the plan. So, let's define a pre-existing condition. A condition for which treatment was rendered or recommended by a physician, or for which drugs or medicine was prescribed within 12 months prior to a covered person's effective date and will not be covered for the following 12-month period. Maternity and prenatal care are considered pre-existing conditions no matter when the pregnancy occurred. However, if the pregnancy is induced because of a medically necessary procedure authorized by a doctor via a cesarean, it will be considered an illness and the expense is covered. It's important to note that pre-existing conditions applies to all benefits with the exception of the preventative care benefit. However, repricing is still available through the multi-plan PHCS PPO network. The rest of the presentation on the HSPGold policy will be devoted to the multi-plan PHCS PPO network. While you can use any doctor or hospital you choose without penalty, you have the option of accessing the PHCS network to take advantage of great savings at no additional costs. The advice here is, always use the multi-plan PHCS PPO network when possible to get costs near or below the benefit value. Here's how network benefits will work when using the HSPGold indemnity plan. Number 1, the policyholder will present the PALIC ID card at the time of service. Again, PALIC stands for Philadelphia American Life Insurance Company. Number 2, the doctor or hospital will verify coverage based on information on the card. Number 3, charges will be forwarded to the National Claims Clearinghouse. Number 4, the National Claims Clearinghouse will electronically forward information through Electronic Commerce Operations Management Line, ECOM for short, who will reprice the claim. Number 5, ECOM will reprice the claim and send it electronically into PALIC's claim system. Number 6, The PPO discount will be shown on the explanation of benefits or EOB that is sent along with the claim payment to the provider of service. Benefit payments in most cases are sent directly to the participating provider. Number 7. If the HSPGold policy pays more than the billed charges, but less than the PPO discount or allowable charge, PALIC will send the provider the PPO allowable amount and reimburse the policyholder the difference. Now, let's look at a couple of repriced claims. Here is an explanation of benefits from a provider in Tyler, Texas, for a metacarpal fracture. This is a broken bone in the hand. As you can see, we have the line items, the date of service, and then the CPT codes. CPT stands for Current Procedural Terminology Codes that signal to the doctor or hospital the amount a procedure should cost. Each procedure has a CPT code with an associated charge. The column titled Charge is what the hospital would have charged had the procedure not been repriced in the multi-plan PHCS PPO network. PHCS stands for Private Health Care Systems. Quick note here, MultiPlan bought the PHCS network in October of 2006 to become one of the nation's largest private healthcare networks. Next, we have the number of days in the hospital and then the allowable charge. The allowable charge is what the MultiPlan PHCS PPO network will allow that provider to charge as a member of PHCS. As you can see, the allowable charges are considerably less than the associated CPT code sticker price. In fact, the allowable charge has a $5,749 savings or a 57% discount off the sticker price. Next, we have two examples of an actual 3-day hospital stay for prostate cancer with a $1,000 deductible using the HSPGold Preferred Plan. The first example on the left using the Preferred Plan has a daily hospital benefit of $4,500 a day. As you can see in the second column, we have CPT notes next to the associated expense. The expense column is what the hospital charges and not what the plan will pay. The total expense for a 3-day hospital stay before using the PHCS network is $24,848.89. The eligible benefit, which is what the plan pays, is $22,303.04. The plan will always pay the assigned benefit amount regardless of the network or other insurances used. Now we subtract our $1,000 deductible last, and we have a payment amount of $3,545.85 that the policyholder owes to the hospital. Now, let's stay in the PHCS network to take advantage of the savings. As you can see, the hospital bill has been repriced by 40%, leaving a total expense of $14,909.33. Now let's apply the eligible benefit and subtract our deductible last. What do you have? An eligible benefit going to the policyholder of $6,393.71. In other words, the policyholder walks out of the hospital with cash. Next, using the same hospital PPO discount expense of $14,909.33 and applying 2 units, or the Plus plan as an eligible benefit, we have a total eligible benefit of $14,868.70. Now we subtract our $1,000 deductible last, and we are left with an out-of-pocket expense of $140,000.63. Compare these out-of-pocket expenses to a major medical plan. Remember, with the major medical plan, the policyholder will pay the deductible first. In many cases, a deductible may be $8,000 or more. This could be your out-of-pocket expense before coinsurance kicks in. This expense, coupled with a monthly premium without a subsidy, makes the total cost of ownership of a major medical plan substantially greater. Next, we see the MultiPlan PHCS PPO network search engine as it would appear online. Here you can search to see if your doctor or hospital is in the network in advance, before having a procedure. What PALIC has hinted to in your favor, already priced into your quote, is PALIC coordinates 4 policies combined as one presentation with one overall premium. Because the HSPGold is an indemnity plan, these other 3 policies are used to support the HSPGold where needed, such as outpatient benefits and additional cancer care. It must be noted that 76% of all emergency room visits are from accidents. Therefore, the second policy is an accident expense plan. Remember, the HSPGold policy always pays in addition to any other policy, such as the enhanced accident expense plan. So now you could have 2 policies contributing to the same accident claim, creating a double indemnity. here is a benefit summary of the Enhanced Accident Expense Plan. We will focus on 2 units, for this is what is shown on most quotes. An accidental injury benefit could include any accident, such as a fall, burn, cut, broken leg, etc. As mentioned before, this plan enriches the outpatient benefit of the HSPGold and has a $50 deductible. The plan will pay $4,000 per incident. Unlike the HSPGold, this plan will pay the exact amount of the claim. The difference will not be forwarded to the policyholder. If there is an accidental death with the primary policyholder, the plan will pay $100,000 to their beneficiary. For ground and air ambulance transportation in the case of an accident, the plan will pay $10,000. Again, this is in addition to the HSPGold ground and air transportation, enriching the total outpatient benefits even stronger for accidents. Therefore, an accident will receive up to $11,000 for ground transportation and $12,500 for air transportation when combined with the HSPGold. If a person is confined in a hospital, the plan will pay $300 a day for 30 days. Major medical plans don't do this. The dismemberment benefits for the Enhanced Accident Expense Plan are, for the loss of a single finger or toe, the single benefit is $1,000, while the multiple loss benefit is $2,000. For the loss of a hand, arm, foot, or leg, the single benefit is $10,000, while the multiple loss benefit is $20,000. For the loss of sight in an accident, the single benefit will pay $10,000, while the multiple loss benefit is $20,000. Now we move to the third policy, critical illness insurance, most likely already included in your quotation. This policy complements the HSPGold in case of a critical illness, such as cancer, heart attack, stroke, and 8 other critical illnesses. This policy can pay up to $50,000 in cash benefits if diagnosed with a critical illness. This benefit is paid directly to you. The logic here is, if you are sick and cannot work, there could be an issue of paying bills, such as your mortgage or car note. This cash benefit can be used for unexpected expenses associated with a critical illness, such as travel, food, transportation, babysitting, car insurance, or just about any expense you can think of, including a vacation. This policy has dual categories. Therefore, if you receive a lifetime cash benefit of $50,000 in the cancer category, you may also receive an additional lifetime benefit of $50,000 in the heart attack and stroke category. This makes this benefit worth a total of $100,000. Last but not least, PALIC has added a specified disease policy. This policy, similar to the critical illness policy, includes conditions and procedures, along with diseases associated with heart attack, stroke, and cancer. Such conditions and procedures include angioplasty, coronary artery bypass surgery, amputation, pacemaker implants, and several other procedures and diseases. Unlike the critical illness policy, these benefits are paid directly to the hospital or physician. In addition, this policy increases the number of doctor options you have in the PHCS network. PALIC has added a number of additional benefits to enhance the HSPGold policy. Caris 360 is a concierge service designed to be your personal advocate. Their services are designed to assist you during each stage of your healthcare experience. This includes unlimited access to a dedicated team of professional advisors available by phone to assist with healthcare-related questions. Caris has expert advisors to help you find the right doctor, healthcare facility, and obtain the best available pricing for procedures and lab tests. Caris will shop local and regional markets for healthcare facility options, which include surgeons and specialists. Also, if your out-of-pocket expenditures are unexpectedly high, Caris will negotiate your medical bills to reduce these costs. Next, PALIC has a referral relationship with PRAM, a fully insured pharmaceutical drug card offering $400 a month of benefits to an individual and $800 a month to a family. This card has co-pays for generic and as well as brand name drugs. When the PRAM drug card is combined with the prescription drug indemnity benefit, your out-of-pocket expense is reduced, and in some instances, eliminated. This card gives great savings if you use prescriptions on a monthly basis. ScriptSave is an online discount prescription drug program. By using this benefit combined with PRAM, you will know the lowest cost and closest location of a prescribed drug near you before purchasing. Finally, for those minor illnesses or common children's sicknesses, there's Teladoc. Teladoc is a convenient alternative to urgent care or ER visits. Teladoc has U.S. board-certified physicians who are available 24/7. Teladoc allows you to be diagnosed and order prescription drugs from the convenience of your home, thereby saving you time and the cost of a doctor's office visit. This is extremely convenient when dealing with children's illnesses and common colds or the flu. To learn how to look up doctors in the PHCS network, get a prescription drug card or discounts on prescription drugs, check Healthcare Blue Book to review charges that are customary, usual, and reasonable, or contact your broker for answers.